Picture this. It's been a long, stressful day at work. You get home, have some dinner, but it doesn't quite feel like the stress of the day has been washed away. You sit down to watch TV, thinking it'll help, and eye the bag of chips you bought. You pick it up, thinking you'll just take a few since you're not hungry anymore after dinner. Before you know it, you're munching and watching TV. When the bag is finished, you feel a little guilty, but you also feel immensely better. You're stress-free. What urges us to eat like this, even when we're not hungry? What happens if we do this too often? Let's talk about emotional eating and binge eating. Let's meet Rob. Rob is a 68-year-old retired accountant who left his profession 2 years ago. He uses food as a way to manage negative emotions such as loneliness, boredom, and grief. His emotional eating habits typically involve consuming comfort foods like ice cream and chips in the evening while watching TV, even when he is not physically hungry. However, Rob maintains control over portion sizes and stops eating once he feels emotionally better, though there is sometimes some mild guilt afterwards. This behavior occurs occasionally and is usually triggered by specific emotional situations. What's going on here? Rob is experiencing something called emotional eating. Emotional eating is characterized by consuming food in response to strong emotions rather than physical hunger. While emotional eating can be triggered by both positive and negative feelings, it's typically associated with negative emotions. In Rob's case, he maintains control over portion sizes and stops eating when he feels emotionally better, which is a common trait of emotional eaters. He experiences mild guilt after these episodes, but doesn't feel extreme shame or regret. When overeating occurs in response to negative emotions, as it does for Rob, it serves as a coping mechanism. However, it's important to note that if this behavior becomes increasingly frequent, or if eating becomes a sole coping strategy, it can develop into a more serious concern if left unaddressed. Let's also meet Sarah. Sarah is a 55-year-old teacher and has struggled with her weight since her teens. She often skips breakfast and lunch, telling herself she's quote-unquote being good. But after a stressful day at work, she starts eating a normal dinner with her family and continues eating long after they've finished. Over the next 2 hours, she consumes a large quantity of food in a short period of time, such as chips, ice cream, and leftovers, eating quickly and past the point of fullness, barely tasting the food. During these episodes, she feels a lack of control and is unable to stop eating. Afterward, Sarah experiences intense shame, disgust, and regret for her actions. These binge episodes occur frequently, multiple times per week. What's going on? Sarah is experiencing something called binge eating disorder, or BED. Binge eating disorder is characterized by episodes of eating large quantities of food rapidly and feeling out of control, even when not physically hungry. This is typically in response to strong emotions or restrictive eating. These episodes often lead to feelings of uncomfortable fullness, and Sarah tends to eat in isolation due to embarrassment about her behavior. Afterward, she experiences feelings of intense guilt, shame, and regret. And unlike emotional eating, binge eating disorder occurs more frequently and involves a greater sense of distress and loss of control. If left untreated, this pattern can have significant physical and emotional consequences. Binge eating disorder and emotional eating share several similarities, but also have distinct differences. Both involve overeating when not physically hungry, often consuming highly palatable foods at a fast pace. Additionally, both can be triggered by restrictive dieting and strong negative emotions and are associated with an increased risk of other eating disorders. However, there are significant differences between the two. A key distinction is the feeling of control. Binge eating disorder is associated with the loss of control during eating episodes, leading to the consumption of a large quantity of food, while emotional eating typically maintains some level of control, leading to more moderate amounts. The aftermath also differs, with binge eating disorder often leading to intense feelings of guilt, shame, and embarrassment following the event, whereas emotional eating may result in milder emotional responses. Frequency is another distinguishing factor, with binge eating disorder characterized by a high frequency of episodes, specifically binge eating at least 1 day per week for at least 3 months. In contrast, emotional eating may occur less frequently and doesn't have a specific frequency threshold for diagnosis. BED is a formally recognized eating disorder in the DSM-5, also known as the Diagnostic and Statistical Manual of Mental Disorders, requiring professional intervention and treatment. while emotional eating, though potentially problematic, can often be managed through self-help strategies or counseling. Understanding these similarities and differences is crucial for proper diagnosis, treatment, and support for individuals struggling with these eating patterns.
Hi, my name is Jenny, and we will be covering some common misconceptions about binge eating and emotional eating before we get into the video. Myth number 1. Only overweight or obese people binge eat. This is a myth because anyone can binge eat. Binge eating is when you eat a lot of food in a short amount of time, which can vary from person to person, especially since everyone has a different metabolic rate. Binge eating is also when you feel that you can't control how much you are eating. Myth number 2. Emotional eating is different from other types of eating. This is a myth because all kinds of eating are emotional. If we attempt to get rid of emotions from eating food, we will unconsciously want to eat foods that have higher sensory content to provide emotional charge. Some examples of this include eating sweeter foods, eating saltier foods, or eating foods with various textures. Myth number 3. Eating habits do not affect one's quality of life. This is a myth because eating habits can affect one's quality of life. It is important to maintain a healthy relationship with food. By developing an unhealthy relationship with food, one may develop excessive restrictive eating habits or even stress eating habits, which can negatively affect their health and negatively affect their quality of life. Last but not least, myth number 4. Binge eating disorder can be fixed by just dieting. This is a myth because binge eating is more than just a simple issue of increased food intake. Binge eating disorder especially involves emotional and psychological struggles. Dieting may also promote binge eating due to its restrictive nature. By restricting food intake and following a strict diet, a sense of deprivation is created, which leads to triggers of intense hunger and food cravings. This results in a loss of control around food, which leads to episodes of binge eating. Additionally, the feeling of guilt that may follow these episodes could amplify the cycle due to not being able to cope with those difficult feelings.
Now that we've looked at what Rob and Sarah are going through, let's dive into what kinds of changes are happening at the neurological level. Dopamine is a special chemical messenger that is involved in feelings of motivation and pleasure and plays a very important role in the brain's reward system. To begin, our brains are able to process certain stimuli, like food, through our sensory structures. This activates the sensory cortex, which is responsible for detecting food cues, the amygdala for emotional importance, and the hypothalamus, which will regulate hunger through the production and release of hormones like leptin. Next, the ventral tegmental area, or VTA, is activated. Think of this as the dopamine factory. After receiving signals, the VTA will label the food as rewarding and then release dopamine, which will travel to the next parts of the pathway, the nucleus accumbens. The nucleus accumbens is the brain's pleasure center. As dopamine enters this region, Rob and Sarah would experience pleasure, which reinforces the association of food and a rewarding feeling. This often fuels the likelihood of repeating the behavior again. Over time, actions like binge and emotional eating will weaken the prefrontal cortex, the structure that controls higher decision-making and self-regulation. This makes it much harder to resist these cravings in the future. Moreover, the dorsal striatum and insula build on this craving and create habits. The striatum stores these eating patterns, which makes binge eating automatic, while the insula will reinforce these cravings and make us think that food is required for emotional relief. On a long-term scale, this can alter homeostasis, the body's natural balance. The body will develop a leptin resistance, meaning the body will stop recognizing signals of satiety. This hormonal dysregulation leads to even more cravings, despite being full. Stress can also act on and even alter this reward pathway to stimulate food addiction. Chronic stress, for example, will reduce dopamine receptor sensitivity, causing a greater load of dopamine to be required to induce the same feelings of pleasure and fulfillment, and ultimately, making these experiences feel less rewarding over time. As a result, people will naturally look for more palatable foods, which are usually high in sugars, fats, and salt, to trigger dopamine surges. This will also lead to food addiction-like behaviors.
Binge eating disorder and emotional eating are often associated with serious health consequences. If emotional eating, as mentioned before, is the only coping strategy an individual has, it can lead to binge eating disorder and a higher risk of other eating disorders. Some physical health consequences include an increased risk of overweight and obesity, high cholesterol, high blood pressure, diabetes, heart disease, and some types of cancers. Our mental health can also be severely affected, including an increased risk of depression, anxiety and stress, low self-esteem, psychiatric illness, and substance abuse problems. Our social behaviors can also be affected, including an increased risk of social isolation, difficulties in daily functioning, and poor dietary patterns.
So what can you do? The first tip is to seek professional support. Psychotherapy and nutrition counseling can provide personalized strategies to understand and manage eating behaviors. Second, talk to your healthcare provider. Open communication helps you to access the right resources and support systems. Third, develop healthy coping mechanisms. Try mindfulness, journaling, physical exercise, or engaging in hobbies to manage emotions in a positive way. Fourth, identify your triggers. Recognize environmental triggers. This can be specific settings or situations, or internal triggers such as emotions and stressors that may be contributing to these emotional eating. In terms of resources, the National Eating Disorder Information Center, otherwise known as NEDIC, offers information, referrals, and support across Canada. In Hamilton, St. Joseph's Healthcare provides an eating disorders program for adults, while McMaster Children's Hospital offers specialized services for children and adolescents. There is also Body Brave, a Hamilton-based charity that provides online treatment and support services. Seeking help is a sign of strength, and with the right support and strategies, individuals can navigate and overcome challenges to binge and emotional eating.